Hey guys, good evening, good morning, good afternoon. We're gonna have another podcast today, and we have a new guest, Dr. Drescher. Nice to meet you, nice to see you.
Thanks for
And as usual, first question: what's happened? How you become a dentist?
Well, basically, I've always been interested in the mouth, interested in teeth, and my uncle is a dentist. There's usually always a family connection, I feel like, but not my immediate, family. But the thing that made me most interested is its blend of art and science. In addition to how something so small can still be so complicated. Our teeth are, a smaller part of our body than some of our bigger bones, but they can still make an impact on the rest of our overall health. Mm-hmm. So those are two of the big driving things that made me go into it.
You talk about art. Why do you think art? It's like in dentistry, in dental technician, art. Why it's art?
Well, especially in what you do. I mean, you guys definitely have more of an eye for, the different hues, value, the way that the shapes are, The same tooth can have so many different variations in anatomy. That's always what made me fascinated about it. So I still think back, to when we were in dental anatomy, learning, first how to wax cones and wax teeth. There was a question on one of our quizzes that showed us all the different, premolars, molars of different shapes and sizes. And they say, why are these teeth are all the same number? Why are they so different? Because nature is variation, and you're never going to have the same teeth in two different people. So that helps you, kind of understand that you're not just going to be one size fits all treating things. So
the next question should be like all the way down, but like you said about art, I want to ask you, but now everything gonna go more digitally. Do you think the art gonna go away, or it's still gonna, because like to us, molars, premolars, forget about it, just like they gone. I'm talking gone, it's mean it's just nothing to do. You just click the bottom and it's gone. But front is still, we kind of have to be artistic. What do you think about it's gonna go away, or it's still gonna be in?
It's still important because they know, not every solution is going to be able to be digital. There are still some instances I still do analog impressions, things like that if I have to. But at the same time, even though we are doing it more computerized now, you still got to know how to design it on a computer. It may take away a little bit of the art aspect of it, but it still is, designing something that's going to be, prosthetic for somebody. So you still have that, design element in there, even though it may not be hand waxing and hand characterizing like we used to. Right. So,
when you said you decided to be a dentist, you decided this like when you were so young, or like after high school or during the high school?
It was during high school. So that was when I really started getting into it. I started helping out my uncle at his dental office. I would, shadow, and I would also pitch in and help out, because one of the things that's dental assistants don't in every state need certification or, things like that. So you can just do on-the-job training. So for one summer, I was his sterilization tech and did, just basically odds and ends. It was the best fed summer I had, because it was hilarious that I did a lot of projects that his regular assistant didn't want to do. So he decided that if I did these projects his assistant didn't want to do, then, she owed me a buffalo burger, because his office is right next to a restaurant that was like a burger restaurant. So he was like,
around here, or?
No, he actually lives in Colorado. So in the mountains of Colorado. So, but yeah, he'd always say, well, guess what? I forget her name now, but he would say, guess what? So-and-so, Matt just did this project in one day that you haven't done for over a month, so you owe him a buffalo burger.
And you probably finished some bachelor school, and after you decided to go to dental school. What dental school did you go?
So, I went to University of Iowa. So, that's, I know I was saying earlier, because of the, big tournament in basketball right now, since they pulled off the upset against Florida. I had to sport the colors for the school for the week. So I actually have a few pairs of these still from when I was in dental school. So because they allowed us to wear them one day a week if we paid the extra money for them. So
cool. How was the school? It was hard for you, easy for you, fun? I know, because it's in the beginning it's fun, but after when it started doing all details, it's kind of begin.
Yeah, it definitely was challenging, because it was unlike anything I'd ever done before. But at the same time, we still had fun. We still had lives. It's some of these things, it was the first time you'd ever done it in your life. Right. And so, it definitely was, challenging at first, but we adapted.
What was the most challenging? Let's say crown or maybe removal?
Ooh, challenging probably was removable.
Yeah, everybody's saying the same.
I feel like we didn't really learn how to do removal until we actually started doing it on people. Like we had a class that was on occlusion and complete dentures our sophomore year at dental school, and that was probably the worst class we had in dental school. So we just didn't really learn a whole lot in it. And then when we got to later stages, the instructor was like, "Didn't they teach you this in occlusion?" And we're like, "No, they didn't teach us like anything in occlusion." So, you know, it was, but that one was definitely one of the more challenging ones. But crown and bridge wasn't too bad. You know, endodontics I picked up pretty quickly as well too. So I would say removable is probably number one in school.
But in your practice, you do everything. You do endodontics, you do removable, you do crown bridge. Do you do any crown bridge? I can say, do you do any veneers too, like aesthetics, cosmetics, everything?
So about the only thing that I don't do is I don't place my own implants.
Okay.
And I don't do wisdom tooth removal, but I do, you know, basic oral surgery. I'll do, you know, veneers, crown and bridge. I'll do, you know, endodontics, things like that. So.
But endodontics, if it's hard case, probably you have to send to.
Yeah, I do refer to specialists in some cases, but you know, it's one of the nice things about being a general dentist is you still have some semblance of case selection.
Yeah.
If it seems like it's something you may not be able to get the best result on, you can still, you know, have a specialist, you know, see them as well too.
Can I ask you, how come we're not doing implants? Nowadays, everybody doing everybody.
Right. I guess to me, I've just gotten comfortable not doing them. I mean, I have a good working relationship with specialists around me that, you know, they, you know, will do the implants, I'll get the restorative, and it's gotten to the point where there are some that I am getting referrals from. They're saying, "Hey, I've worked with you for a while. This person needs a dental home. This person needs a new dentist. I'm sending them to you." So, you know,
like both ways,
it's a two-way street. So I feel like I just don't want to change. So I know there's a lot of people doing implants now, but at this point, you know, I feel like where I'm at is, you know, still good for me. So.
Come back to dental school. When you finished dental school, how hard for you was to find a job? Or did you work in corporate, or you just right away find your own office?
Yeah, so it was a little difficult, especially moving to the area. So, I mean, I originally lived in Iowa, so I didn't, you know, I didn't know anybody around here. So, you know, basically my wife is from around here, and she didn't want to live in Iowa anymore. So we moved back here, and just, it's really helpful to know somebody or know people.
Yeah.
So I'd interviewed, you know, at corporate offices, you know, they'd offered jobs, but they didn't really seem, you know, the best. So first place I worked actually was a group practice in Joliet. So it wasn't corporate, but it was a very large group. It was father and son that owned multiple dental offices, and you know, I was one of the many dentists that worked for them. So, but it wasn't technically like your Aspen or Heartland or, you know, type of corporate outfit.
Just kind of private,
But it was a large private practice. So if I can remember correctly, I haven't worked with that group since 2016, but I think when I was there, I think we had maybe like 20 to 30 dentists among all of their clinics combined. So, you know, there was usually a lot of people there. So.
But in your office now, it's just only you have a couple of associates?
It is just me. So yeah, I used to work.
Everything on you?
So basically I worked, you know, in this office starting part-time in 2016. The owner, I purchased the office at the end of 21, and the owner retired in 23. So for the last, you know, almost 2.5 years, it's been just me.
Just you. So, it's been everything in your hands and in your head, and everything is possibility on you.
The buck stops with me.
Right? Yeah. How hard is it just to deal, patient, we're gonna talk later, but with the staff? What your atmosphere in the office, it's more family, or you just, my way? I know everybody say no, but it's just two ways. Or it's like so kind, or you have to be strict, because otherwise it's not working, right?
Well, I think, you know, especially my wife would say I'm probably a little bit more easygoing or lenient or lax, but, you know, I feel like everybody that works at my office is, you know, an extension of my family, because I spend a lot of time with them.
More than at home,
almost as much as I spend with at home. So, you know, I feel like I try to be as fair as I can. You know, my staff could correct me if I'm wrong, but, you know, I mean, I don't go in there with the my way or the highway attitude, you know, type of thing. Yeah. But, you know, at the same time, you know, the one thing my uncle always told me is the hardest part of owning your own office is definitely the staff and the staff management, you know, because, you know, there's always so many variables, and basically if you have, say, 10 staff members, that's 10 other lives that, you know, revolve around yours as well, too, in addition to your family.
And nowadays it's so hard to find part of the family, because, I don't know, people probably don't want to work, I don't know why, but it's everybody's saying for us and for you guys, it's special hygiene.
Yes.
Right?
Oh yeah.
Why?
It's been the hardest.
Why?
You know, I really don't have the answer to it. I
Nobody
don't
has
know.
the answer. I know.
At the end of the day, there was the report that came out during COVID time that said dental hygiene and dentistry were the two most risky professions for that. And so I guess there were a lot of people that just decided they didn't want to do it anymore, or they decided they were going to retire. I know right after that happened, we did have one of our hygienists retire because she was planning on retiring anyways within a year, but she was like, you know what, after everybody shut down, she just didn't come back. So it was like, I'll just retire now instead. So.
But do you have hygienists right now, or you do everything by yourself?
I do have hygienists, yeah.
So much easier, right?
Oh yeah. I mean, it's not that I dislike doing the preventive, but it is nice to have someone who's dedicated to only doing that versus, you know, doing that in addition to all of the additional casework I have. So.
Let's come back to school again. Like when you're at school, you usually have to get some cases on the real people, right?
Yep.
Do you remember some I mean, not hard. So the case when the kind of was the first case and it was a real person, you have to do something. How was your hands?
Oh yeah, I remember there was definitely a few extra, you know, tears that were being shed or, you know, sweat that was going down that day because, you know, you're used to working on, you know, fake teeth and mannequins and it's like, well, you know, you get so anxious for seeing the patient the first time and, you know, I still remember, I don't remember her name, but I remember the first thing I ever did when on a person was an occlusal filling on number 19.
Oh, man.
And I remember, you know, this is the first time ever working on a person instead of a mannequin, and you're shaking because you're like, oh God, what if I don't get the anesthesia? What if I don't get this? And then, you know, after that part's over, I still remember him in school, you know, making it seem like it was, you know, an automatic failure if you had a pulp exposure or whatever, you know, doing work on the teeth. And, you know, so I opened the tooth and I remember at the time you didn't realize that dentin comes in all different colors, especially when it's, you know, affected by decay. So I remember opening this tooth up and the dentin was like bright red. So I was like, oh my God, I just exposed the pulp on the first patient I ever saw, you know. And so it was, you know, one of those deep anxiety moments where I, you know, called the instructor and the instructor was like, no, the access looks great. Now you just got to remove the rest of the decay. And I was like, oh, okay. And so, you know, it was okay after that. But an occlusal filling that took 2.5 hours.
Wow. It's probably, right now it's not happening, right?
No, usually now an occlusal filling probably takes about 30 minutes.
Time changed. Like I remember, like all the way, you have gold fillings, you have like amalgam, silver, but it's gone, right?
Yeah, I don't think I've done an amalgam in probably 10 years.
10 years.
So we don't even have it in the office.
Really?
So yeah, I mean, it's a good restorative material. It's just, you know, definitely a lot different than handling composite.
Yeah.
I mean, we learned how to do amalgam in school. We didn't learn how to do gold, like the gold foils, but we did do like gold inlays and onlays, you know.
Do you still do gold crowns?
I do.
Perfect.
If needed, I do.
Perfect. It's, I mean, to me, it's most safe and most, in the mouth, most soft and safe. Like, let's say second, first molars, nobody can see, but it's stay forever.
Yeah. That leads me to another one where, you know, I know you gave me some ideas to talk about, but funny story about that where I had, you know, a gold crown. I did a gold crown on a guy's front tooth as well once too when I was in dental school, which turned out to be kind of an endeavor because he was an employee of the university, you know, over 18, so he could, you know, make his own decisions. So he decided he wanted a gold tooth in his front tooth. So the faculty was like,
full gold.
Yeah. So the faculty was like, okay, fine, you know, make him a gold tooth. Made him a gold tooth. Guy loved it.
Really?
Week later, the guy ends up on my schedule again, you know, to look at his crown. So he comes in. Wife is extremely mad because she said, how could you ever, you know, think that this would look good on a front tooth? You're the one who told him he needed a gold crown on this tooth. You know, I can't believe that you did that, you know, and blah, 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 blah. And the faculty member came up and said, well, ma'am, your husband's over 18, and is this his signature on the piece of paper right here that he wanted to have a gold crown? And she was like, yeah. And he was like, yeah, I was the faculty member that supervised this case. He came in and said that he wanted a gold crown. There's nothing wrong with that crown, so, you know, I don't know what you want us to do. I mean, we can cut it off for him, but it's going to cost you extra, and he might need a root canal on it. So the wife looked at him, she was like, oh, really? That's what happened. So the faculty member kind of, you know, waved me over to the side, and he's like, guarantee you he never told the wife he was doing that, and she's mad because he did that. So we'll just let him yell at each other for 5 minutes and then dismiss him because there's nothing wrong with that crown.
Because you just said, and I remember long time ago, I'm a ceramist, and it was a gold crown with a facial opening, and I have to do the black hugs inside. It took me many days because I have to do Microsoft. But I remember we did a full gold crown and a number 8, and I cut the window, and I have to do on the porcelain. I have to do black hearts. I mean, how many times I just remove porcelain, put porcelain, remove porcelain. Finally, we did, and the patient put in the mouth. It was beautiful, but I was asking, why? How are you gonna walk with like gold? It was my dream. It was a young guy too.
Yeah.
Probably he's working somewhere because it's probably forever. My porcelain changed color for sure, but yeah, gold crown. It's gold crown. And where I came from, like from Europe, people who got money, they just want to have like 60s. They want gold crown because they just want to show people they have money. And people who work in special in the Asian republics, like 6, all 6 already with gold crowns. You can say, oh, that's people have money.
Yeah.
Yeah. Well, how do you like digital?
I like digital.
It's
digital. Definitely made life easier, and it's definitely come a long way too. So, I remember the first experience I had with a scanner was in dental school, but it was they were still in their infancy.
Intro.
The intraoral scanners. So it was, I forget which brand they had at school now, but I still remember they had this little powder dispenser gun. You had to spray all over everything, and it went everywhere, and it was a mess because the camera wasn't as high a clarity as the ones that are now. So these ones now, they're outstanding. So
what's your preference? What do you have?
So I have a 3-shape, Trios 3-shape. I love it. It does a real nice job. So exactly. I mean, I have
nothing to 3-shape. It's just good.
Yeah, no, I hate to sound like an advertisement. But
exactly.
I use that one. It's fantastic. I mean, I also have an iTero scanner that I use primarily for aligners, but I usually restorative, 100% use the 3-shape.
Even for let's say even for dentures too.
I have scanned for dentures. I still feel more comfortable doing them analog, but I have done digital dentures with it, and it's still, you still have the step where you have to border mold and you have to get
or
some of the
take
other
wash
things.
impression.
Right.
Okay.
Yeah, because more or less, you scan, but it's never going to show you how the muscles actually move. So you have to wash either you're trying or you have to still border mold somehow. So I just still have done the analog way for the most part. So,
but even for crowns, probably use scans.
Yeah, crowns, bridges, implants. The All-on-X I'm working on right now, I just did photogrammetry with the 3-shape scanner. So it's did really well.
It helps a lot, But what I'm thinking, it's still like everybody's saying, okay, we have to go 100% digital because it's much faster, much easier, cheaper, and not by cheaper. But nothing we can do without analog because it's still some cases we have to do analog way, right?
Right.
Do you agree?
I agree. I've done so in the last, the last 6 months I've done 3 All-on-X's. One of them I did analog and the other 2 I've done digitally. So because it just was better to do analog, and it worked out fine, but it's definitely a little bit more of a pain having to cut the tray, do the open tray impression, copings.
But you do by yourself?
Yeah.
No, with technician.
No, I did the impression myself.
Wow.
So I had the technician come in for the wax try-in. I did impression and I did it myself. So I guess I didn't know that technicians did the impressions sometimes. I just always did it myself. So.
I'm thinking about me. We are good. We can do it ourselves. Perfect. Okay. Let's forget about dentistry. What I know you have family, you have kids, but what's your hobby? I know you told me about hockey.
Yep.
How you become your sport hockey? And so many sports are but hockey. You just start when you were a kid.
Yep, when I was young. So the thing that made me get into it was before I lived in Iowa, we lived in suburban Denver, Colorado. So, and we were there the first year that the Avalanche moved from Quebec. So everybody got hockey fever. And I'd been playing inline hockey, outside before I switched to ice. I started doing that just in the street with my friends and, recreation league hockey. But then once the ice hockey moved back into Denver, that's when it really took off for me. And I played, through college. I still knocked the puck around in a men's league with my neighbor, so definitely not as fast as I used to be. But you still have a feel for the game. Your eyesight may not be as sharp and you may not be as fast, but I look at these 20-something-year-old guys that come and play in the men's league, and it's like, I wish I was still that fast. But
well, you remember your 20 years when you played.
Yeah, it was a little faster.
And your kids playing hockey?
No, neither of my kids do. So both of my daughters are into more artistic things. They do,
Okay.
you know, one of them does gymnastics, one of them does, you know, dance, you know, things like that.
Okay.
So they're more into that, which
No
is
more
fine,
ice.
so,
No more ice for you. Only you.
yeah, just for me. So
Only you.
they like skating, but I don't think hockey is ever going to be a major
Yeah,
thing.
it's hard, expensive, time consuming, dangerous, but I love the sport. Actually, I never play.
Yeah.
I never play. No, never skates, but I just don't know. I love the sport.
Yeah, I mean, that's definitely the biggest.
What else we're gonna talk? We're gonna talk about. Let's say if you already practice for like more than 10 years, right?
Mhm.
10 years is like another generation. What do you think like young guys who are gonna come out from school? Or they can have totally new mentality about digital, or because they teach totally different stuff right now in the schools. But I know young guys are losing this kind of not analog way. They're losing like feeling real stuff like artistry, because I mean, you know, like you take a scanner, you scan, you forget. When you take impression or you do, let's say, you take impression, you kind of feel it's a tooth. It's like art because every tooth, every person, totally different, right?
Mm-hmm.
How for them gonna be for this young generation when they come out from school? What's the difference for them?
I mean, I think they're going to be doing a lot more digital. I mean,
Mhm.
I don't know if they're even training them to do some of the analog things anymore. I mean, I haven't worked with any newer grads in a long time, but you know, I just feel like digital is going to be the new way, where you know it's going to be the one size fits all. And you know, there's even talk about, you know, some dental robots out there, you know, to do robotic surgeries and things like that. You know that you know, they may be training them on that and operating a robot instead of actually doing it themselves.
Yeah, we have
you know?
one oral surgeon. He does only with yoni. It means he said it's precise.
Yeah.
It's doesn't give any mistake. What I can do, like he said by myself, but it's perfect.
Yeah.
Unbelievable.
I mean, they may be getting training in that for all we know. I mean, some of these, you know, things that weren't available when we were in school, they're probably getting training on too. I mean,
And it's only 10, 15 years.
Right. I mean, that's what I see, at least, you know, the shift towards, you know, especially at how much AI has come about now. It's like, you know, I'm sure there's going to be a lot more reliance on technology, you know, because, you know, there's less chance for operator error, less chance for, you know, error, but it's, you know, still got to be controlled by somebody. So you train on the machine instead of actually training on, you know, how to actually feel a handpiece is what's going to be,
like,
I think.
feeling,
Right.
What do you think about, let's say, about the night guards? Is it because more and more people like we do night guards, like all necessary, not necessary, like because nowadays like everybody want night guards.
Yeah. I definitely think it's a good thing to have.
You think?
Oh yeah. I mean, I've seen it a lot, especially after COVID. It's amazing the number of split teeth that I've seen on virgin teeth.
Mm-hmm.
You know, teeth that don't even have restorations, where people are splitting them. I just extracted one last week on a patient who was maxillary first premolar.
Mm-hmm.
It was split in half completely, not a single restoration on the tooth. You know, I've seen that a lot more. And I think it's because, you know, clenching and grinding, you know, and it definitely can help. It's not going to stop them from grinding, but it can help limit the wear on the teeth, actually. So, I mean, I don't tell every single person in my office they need to get a night guard, but if they're showing signs of wear facets, they're cracking teeth, they're, you know, having cusp fractures, things like that, I think it is definitely something that's helpful.
Whitening. What do you think about whitening? Everybody now. I mean, Hollywood smile, right?
Yeah, well, if we could all look like Steve Harvey, that'd be great, right? So, you know, I think, I mean, it's more of a cosmetic thing than, you know, something that's a necessity. But if, you know, people want to do it, you know, I'm not going to try to talk them out of it unless they have a lot of sensitivity issues or, you know, a lot of recession that's going to, you know, contribute to sensitivity. But, you know, at the end of the day, I don't push it too hard, but if people want it, you know, I don't try to talk them out of it, basically, is kind of the way I feel about it.
Not so dangerous. I'm a dangerous about it. And MLS got so sensitive sometimes, you know.
Yeah, I mean, if you do it correctly, you know, you're going to have lower, you know, risk. I mean, if you're doing it too frequently, using too high of a concentration, leaving it on too long, yeah, you can start to see enamel problems. But if you're, you know, following the way that it's prescribed, you know, you don't have as much risk as if you're doing it in that instance. So that's why, you know, I think it's definitely important, you know, to do it with someone who's done it and knows what they're doing. I mean, I know there's some of those like whitening shops at like the mall and things like that. And it's like, well, you know, I still remember years ago, my mom was on this board of directors for the fraternity she was in when she
Okay.
was in college, and she was the one at the the Iowa chapter, and she was asking me about, what do you think about this? There was apparently this guy who came to the sorority, that was asking, if he could come in there and do whitening on all of the, sorority girls, and it was a guy who came in and just wasn't a dentist, but he just was one of those, like traveling whitening people. And I kind of told her, I was like, I'd be kind of skeptical what this guy says he can do, because I don't know what training he's had, I don't know what product he's using, I don't know, how effective it's going to be, so I just definitely have to be careful with it.
Because old days, like usually they use a gel or some, but nowadays you can do like a laser, right? Some kind of laser
Yeah,
stuff.
so I mean, there's the light acceleration as well too, but yeah, I mean, there still is, peroxide of some sort involved, but yeah, you do have, lasers and lights that can kind of accelerate the
Much
effect.
faster.
Yeah.
Any advice to people, to young people, how to keep your teeth safe? What you have to do, what you have to eat or not eat, what you have to do.
Yeah, well, the stereotypical answer,
I know,
stay away from
yeah.
the sweets, right?
Yeah, but how can you say about it?
I mean, basically, just like they tell you with everything,
Right.
with eating and drinking. I mean, if you do it in moderation, I mean, one piece of candy isn't going to kill you, but if you're sipping, regular pop, throughout the day, every day, it's going to definitely, be a problem. So I think, just kind of being, more in moderation with things, being sensible about the, things that you eat between meals. How much of the sugary things that you consume, but some of the really hard stuff you don't want to be having too much of. I mean, I still can't believe when we were kids they used to sell those jawbreakers that were like this big, you could barely even fit in your mouth, and it's like, oh god, those do a number on teeth, but
Toothbrushes, regular toothbrush, or now everybody have an electric. Was it
I like the electrics. I still use a hand brush when I travel, but electric I use at home all the time, just because, as I always tell patients, it gives you a more consistent stroke when you're brushing.
Okay.
You're not going to be, and a lot of these now even have sensors on them to tell if you're pressing too hard, not pressing, spending too long in one area. Just like with everything, they all have an app. You download an app with your toothbrush.
Really?
That
I did
tells
not know that,
that tells you, okay, here's how you did yesterday. You spent a little too long here. You spent not enough time here. You missed here. And it usually has like a little buzzer or sensor that if you're pressing too hard, it'll kind of buzz so that you're pressing too hard.
I have one, but probably it's a simple one. I don't know.
Yeah.
Wow.
Some of the ones, I mean, those are the expensive ones. You can get ones that are fairly simple, but the expensive ones, it's like, they have
Water
all
pick.
the things.
What do you think about water pick?
I think water picks are
more
good in some
and more.
instances. I mean, it just is really to help reduce the amount of plaque that the brushes may not get. The thing that's really helpful for is like orthodontic appliances, or folks that do have like all-on-X's, things like that, where you're going to want to make sure that you don't have anything trapped along the flanges at all. I mean, obviously, you try not to have that with your design, but at the same time, you still want to use that to clean as effectively as you can. But I don't think everybody has to use one. So, it's kind of more case dependent, patient dependent, things like that.
Doc, it was a pleasure. Very nice. Probably we can meet again some way later. Maybe we're gonna find some different topic. Let's say about hockey. We can talk about, forget about dentistry. We can talk about NHL, something new. Why not, right?
I think I could talk hockey all day if you give me the chance.
Me too.
So.
We will. We can give experience, different teams, different generation of hockey players, because it's so much we can talk about.
Oh yeah.
Doc,
I mean,
thank you very much.
thank you.
Appreciate you coming.
Yeah.
Thank you.
It was nice